There's something unsettling about hospitals, isn't there? Maybe it's the way time feels different inside. The smell of antiseptic, the hushed voices, the quiet footsteps at odd hours. It's a place where life begins, and where it ends. I've spent enough time in hospital rooms to know that death doesn't always come quietly. It doesn't always come alone. And for some, it doesn't come when it should. Elias Carter was dying. He knew it. The doctors knew it. But the way he looked at them, the way he started watching the ceiling, the door, the shadows in the corners, that wasn't the look of a man afraid of death. It was the look of a man waiting for something far worse. The nurses whispered about room 306. About the patients who saw things before they passed. The ones who begged not to be left alone. The ones who died with their eyes wide open, staring at something no one else could see. Elias wasn't afraid of dying. But he was terrified of what was waiting for him before he did. The doctors thought it was the medication. The fever. The mind playing tricks. Then the cameras caught something. And that's when the screaming started. Elias Carter walked into this hospital. But he never walked out. And before he died, he told us what he saw. There are places in this world where the air feels heavier. Where the walls have absorbed too much suffering, too many last breaths, too many whispers from the other side. St. Augustine Asylum was one of those places. They called it a hospital, but it never felt like one. The building was old, older than anyone working there. It had started as a mental institution back in the 1920s, the kind where patients were forgotten, locked away behind iron doors, screaming until their voices gave out. Some say their screams never really stopped. That if you listen closely, late at night, you could still hear them in the walls. By the time Elias Carter was admitted, St. Augustine had been renovated. The paint was fresh, the halls were quiet, but underneath, nothing had changed. Elias was 78 years old. Terminal lung cancer. The kind where the doctors stop talking about treatments and start talking about making him comfortable. He had no family, no visitors. Just an old man in a bed, waiting for the inevitable. At first, he was just another patient. Quiet. Polite. But then they moved him to room 306. That's when everything changed. The nurses didn't talk about room 306. Not openly. But there were stories. About how patients in that room always seemed different. They became restless. They stopped sleeping. They spoke to people who weren't there. And when they died, they all died the same way. Eyes open. Mouth frozen in a silent scream. And fingernails cracked and bloody, as if they had tried to claw their way out of their own skin. Elias didn't know any of this when they wheeled him in. But the nurses did. They exchanged glances as they adjusted his floor, their hands moving a little too fast. One of them, a younger girl named Claire, hesitated before stepping out. "You'll be fine, Mr. Carter," she said. But her voice had a slight tremor. And before she left, she did something strange. She took off the small silver cross around her neck and left it on his bedside table. That should have been his first warning. Night 1, the whisper in the dark. The first night, Nurse Claire checked on Elias just after midnight. She found him sitting upright in bed, staring at the foot of it. His breathing was shallow, his hands gripping the sheets so tightly his knuckles had gone white. "Mr. Carter?" she whispered. "Are you all right?" His voice was barely above a whisper. "There's something in here with me, watching." Claire turned, scanning the room. The dim glow of the hallway light seeped under the door. The window was locked. The monitor beeped steadily. Nothing was there. "It's just you and me, Mr. Carter," she said gently, adjusting his blankets. Elias didn't respond. His eyes never left the foot of the bed. Night 2, the conversations with the unseen. By the second night, Elias had stopped eating, stopped responding to the nurses. But at exactly 2:17 a.m., the night shift security guard noticed something strange on the monitors. Elias was talking, but no one was in the room. His lips moved slowly, deliberately. He would pause, as if listening, then respond. "Why are you here?" A pause. "What do you want?" Claire, watching from the hallway, hesitated before stepping inside. "Mr. Carter? Who are you talking to?" "He's standing right next to you," Elias whispered. Claire barely stifled a scream as she stumbled backward, slamming the light switch on. The bulb flickered back to life. The room was empty. Hospitals are kept warm, comforting. But that night, room 306 was freezing. The thermostat read 74 degrees. But Claire could see her breath in the air. Elias, drenched in sweat, clutched his blankets to his chest, shivering. "They come when I close my eyes," he said. "Who?" Claire whispered. Elias's lips trembled. His voice barely made a sound. "The ones who never left." Night 3, the shadows in the monitor. By the third night, the staff had started avoiding room 306. They whispered about Elias at the nurse's station. About how he had stopped sleeping entirely. About how, if you walked past his room late at night, you could hear him whispering. That night, just past 3 a.m., the security guard, Tom Weaver, was flipping through the hospital cameras. He stopped at room 306. At first, everything looked normal. Elias sat in bed, staring at the window. But then, the screen flickered. For a fraction of a second, something moved in the corner of the screen. A shape. A figure. Too tall, too thin, standing in the farthest, darkest part of the room. The screen went black. When it came back on, Elias was no longer looking at the window. He was staring directly into the camera. Night 4, the writing on the glass. On the fourth night, Nurse Claire walked past room 306 during her rounds. She didn't mean to look inside, but something caught her eye. Elias was asleep, finally. His chest rose and fell in shallow, uneven breaths. But what made Claire stop wasn't him. It was the window. There was something written on it. Words, traced into the condensation from the cold. "Help me." Claire backed away. But as she did, something happened. The window was on the 3rd floor. Hospitals see death every day. It lingers in the air, in the sterile white halls, in the empty beds left behind. But what was happening in room 306 wasn't death. It was something worse. By the third night, Elias Carter had stopped speaking. He sat upright in bed, his eyes sunken, his skin pale. He hadn't slept. Hadn't eaten. But the worst part? His arms. Bruised. Scratched. Marked by something unseen. Nurse Claire found him just past 2 a.m., curled into himself, his fingers twitching against his blanket. His lips moved, silent prayers, soundless pleas. Then, without warning, Elias thrashed in bed, his fingers clawing at his own arms, his nails raking deep, red lines into his skin. "Get them off me!" he howled. "They're holding me down." Claire lunged forward, grabbing his hands, trying to stop him, but his strength was unnatural, feral. "There's nothing there," she cried, but Elias was sobbing now, his eyes wide in terror. "They don't want me to leave," Elias rasped. "They won't let me go." Tom Weaver had worked security at St. Augustine for over a decade. He had seen things, patients passing, families grieving. But what he saw that night made him quit. The cameras were quiet, just flickering images of the empty corridors. But as he watched, something moved. A figure. Lurking at the far end of the hallway, just outside room 306. He switched feeds. The next camera, nothing. The hallway was empty. He switched back. The figure was closer. It had no face. Just a smooth, hollow void where eyes should be. And it was staring at the camera. The camera feed went dead. Tom grabbed his radio, his breath coming fast. "Something's in the west corridor," he whispered. Tom dropped the radio. He was gone by sunrise. Dr. Patel had been checking Elias's vitals. Everything, his heart rate, his oxygen levels, seemed normal. And yet, the patient was deteriorating. He was mumbling now, words slurred, his skin clammy. Dr. Patel leaned in closer. "Mr. Carter, can you hear me?" Elias's lips moved, but the doctor couldn't make out the words. "What was that?" he asked. A chill ran down Dr. Patel's spine. He turned his head, just a fraction. Just enough to see the reflection in the window. Dr. Patel stumbled back, knocking over a tray of instruments. The clatter was deafening. When he looked up, Elias let out a weak, bitter laugh. "Told you," he whispered. Nurse Anna had been avoiding room 306. Everyone had. But that night, she had no choice. Elias's bag needed to be changed. She stepped inside, her fingers trembling as she adjusted the drip. Elias didn't react. He was awake, but staring past her. At the far wall. She turned, just for a second. Then something grabbed her wrist. Ice cold. Fingers wrapped around her skin. She yanked her arm back, spinning around. But when she looked down, something had touched her. And it hadn't let go. They say hospitals are where the living and the dead exist side by side. That some patients never leave. That some never can. And on the final night of Elias Carter's life, something proved that to be true. 2:56 a.m. A nurse making her rounds hesitated at the entrance to room 306. She heard it before she even touched the door handle. A voice, low and broken, repeating the same thing over and over again. Elias. His voice was cracked, barely above a breath, but there was something wrong about it. It wasn't just fear. It was knowing. She pushed the door open. The lights inside flickered weakly. Elias sat curled in his bed, his knees drawn up to his chest. His hands were shaking, clutching at the sheets like a drowning man gripping a lifeline. The nurse took a step closer. Elias shrieked, his head snapping toward her. "Don't let it out." In the security office, the monitors glitched. The hallway feeds blinked to static, except for one. Room 306. The camera caught everything. Elias, in his bed. The nurse, frozen in the corner, clutching the emergency button. And then, Elias started to rise. Not sitting up. Not pulling himself upright. He was levitating. His body hovered inches above the mattress. His limbs were limp. His mouth hung open in a silent scream. And then, he slammed back down. The bed frame dented. The nurse screamed. The monitors flatlined. Elias Carter was dead. Or at least, he should have been. The doctors rushed in, the crash cart already rolling through the door. They called his name. Shook his shoulders. Checked the monitors. No pulse. No breath. And then, Elias sat up. His eyes were open, but they weren't his anymore. He smiled. Not a warm smile. Not a grateful, relieved, or even a confused smile. A knowing smile. His lips parted, and he whispered something. But the thing is, no one in the room could hear what he said. Because the moment the words left his mouth, the security footage corrupted. Every camera. Every file. Every backup. Gone. Elias Carter was pronounced dead at 3:07 a.m. His body was taken to the morgue. The staff was shaken but followed procedure. But here's the thing. The next morning, his bed was empty. No records of a transfer. No explanation. And on the wall, where his bed had been, someone had scratched 4 words into the plaster. "I told you so." Hospitals see death every day. It lingers in the air, settles into the walls, and seeps into the very foundation. But St. Augustine Asylum was different. After Elias Carter's death, room 306 was permanently sealed. No more patients. No more night shifts. No more reports. The administration refused to explain why. For weeks, the staff whispered about the footage. The corrupted files. The way Elias moved before he died. And then, someone tried to recover the audio. They expected white noise. Expected nothing but silence and corrupted data. But after hours of processing, cleaning, and enhancing the final seconds of Elias Carter's last breath, they finally heard it. It's still here. Every technician who worked on that file quit the very next day. For months, nothing happened. St. Augustine kept running. Patients came and went. Staff rotations changed. And then one day, the inevitable happened. Room 306 was reassigned. A new patient. A man named Daniel Whitaker. late 50s. In for observation after a minor heart attack. No history of hallucinations. No signs of mental illness. A completely normal patient. That first night, he slept soundly. The second night, he started complaining about whispers. By the third night, the nurses found him curled in the corner of the room, shaking, muttering something over and over again. "It's in the walls. It's in the walls. It's in the walls." 3:06 a.m. A nurse on duty heard a noise from room 306. She rushed down the hallway, heart pounding, dreading what she might find. She reached the room. She opened the door. The bed was empty. No Daniel Whitaker. No sheets. No sign of a struggle. But on the wall, carved into the plaster, just like before, "I told you so." The unanswered questions. What is St. Augustine hiding? The hospital refuses to comment on what happened that night. Daniel Whitaker's records were erased. No missing persons report. No family demanding answers. It's like he was never there. But tell me, do you believe hospitals hide things? Do you believe something unnatural still lingers inside room 306? Because if you listen closely, you might hear it too. Fire, have you ever experienced something unexplainable in a hospital? Eyes, ever seen or heard something you couldn't explain? Speech balloon, comment below. I want to hear your stories. Pushpin, and if you're brave enough, stay tuned for the next nightmare.